We'd like to welcome you today and thank you for joining us. We're going to talk about when you go home after a robotic prostatectomy surgery. We're going to cover diet and some activity and returning to work and information such as that. Just remember that this is guidelines only. If your physician tells you something differently, make sure you go with what he says. We will send you home with enough supplies when you get home to take care of your dressings and your catheters and all of that. And we do remind you again, make sure you use good hand hygiene, and that's washing your hands thoroughly before and after you do anything with your catheter. Now, as far as diet goes, when you get home, you would want to drink plenty of liquids, and that's just to keep the urine nice and clean and flowing well. We will also encourage you when you get home, once you pass gas, and that's out your bottom, not burp, then you can have soft foods for about 24 hours and then you go back to your regular diet. And if you're taking lots of pain medicines and stuff, we do encourage you to have high fiber foods and stuff for constipation. At home, you will continue to walk. We do have restrictions when you get home as far as how much you can lift, and that's only 10 pounds. And you have to remember a gallon of milk is about 7 or 8 pounds, so just, you can't lift a whole lot once you get home. We also encourage you to build up your activity. Don't just jump out there and start going again like nothing ever happened. If you like to walk a lot, just remember as far as you walk, you've got to get back home, so just take it in pieces as you go. Driving, once you get out of the hospital, we ask that you don't drive for probably up to 2 weeks. They usually tell you at your follow-up visit in 7 to 10 days how much longer you need to go without driving. You will want to not take long car rides just because you've got at risk for blood clots, and then just sitting can cause some pain. So if you say live somewhere else like Virginia or somewhere, you want to make sure you walk at least every hour when you're taking a car ride. And no driving while you're on any pain medications, as far as narcotic pain medications. As far as returning to work, it depends on if you are desk work or strenuous work. If you work at a desk, you can return to work in 1 to 2 weeks. But if you are strenuous activities, then you will want to wait for the full 6-week period before you go back to work.
After patients go home, they have reported to us that sometimes they have a lot of pain underneath their scrotal area. And we've attributed this to that at home they're probably sitting straight up more. In the hospital we have you in the bed, walking. You're not really sitting in a straight upright chair. So that puts a lot of pressure down in that area. You can have some swelling and bruising. So what we recommend is that you change your activity. You walk some, you sit some, that kind of thing. One guy reported to us that he sat through a 2-hour movie and he regretted it.
Dearly.
Because it was 2 hours sitting. So just pause your movie, walk around and come back to that kind of thing. A recliner can help with this pain. Our donut cushion can also help with this pain. Usually this pain goes away within 2 weeks after your surgery. Constipation is a side effect of pain medicine as well as abdominal surgery. So you want to kind of be proactive with that. So when you go home, we want you to drink those fluids like Tara said. You want to eat good fruits and veggies. We'll also start you on a stool softener in the hospital, Colace. You take that twice a day. It's over-the-counter medicine. We want to continue that during the post-operative period. If you're someone that takes Metamucil or Miralax, you also want to continue to take that. Remember, it's been 3 or 4 days since you've had food, solid food, so it's going to be 3 or 4 more days till you have a bowel movement. In fact, we've had patients report it's up to 4 days after surgery that they did have that first bowel movement. If you start feeling a little uncomfortable, you can start with some milk of magnesia or some hot prune juice, things like that to stimulate a bowel movement. Just remember, after surgery, you don't want to do anything like a suppository or an enema.
And having said that, when you're in the hospital and the first day post-op, the doctor will come in, and most all the physicians do order a suppository just to kind of get the gases going and stuff in there. It's not to make you have a bowel movement, but we will give you something rectally or like a suppository, but then after that we ask that you do not use anything.
Kind of wakes those intestines back up. At home, your Incision Care, we want to keep those incisions clean and dry. You can take a shower the day after you go home, so that's 2 days after your surgery. You can hop in the shower. You're going to take, the only dressing you're going to have is over the suction bulb where we've taken that out. We've cut the stitch in that so it has to seal off on its own. That should be the only dressing that you take off. You hop in the shower, let that warm water run on those incisions. I probably wouldn't soap them up, but just let that warm water run on them. You can get either bag for your catheter wet. It's okay. You can hang your bag either on the nozzle or have your leg bag on your leg. It's okay to get them wet. Always remember though, don't take any tub baths. Always take a shower. You don't want to soak those incisions in water. Once you get out of that shower, pat everything dry, keep those incisions good and dry, towel dry your bags, and then you're not going to put anything on any of the incisions except the one where the drain came, and you're going to put your clean 4x4 gauze and tape over that, and then repeat the next day.
And that usually lasts for around 4 to 5 days for the oozing to stop. Some people continue after that just to kind of make sure nothing gets on their clothes, but it should stop draining after about 4 to 5 days.
And if you have any of the following, you should call your surgeon as soon as possible. If you have any redness, swelling, or warmth along the incision site, that can be a sign of infection. Temperature greater than 101 degrees. Heavy bleeding or clots in your urine. Decreased urinary output or difficulty with your catheter. A foul odor to your urine. Your catheter comes out or is leaking. Or any drug reaction to the medicines we give you. Your first follow-up appointment after surgery is usually within 2 weeks. You'll have your catheter removed, so come prepared. This is when you need to bring your pull-ups and your pads and maybe a pad for the car. Your urine leakage will be the worst on this day. This is the ground zero of leakage. It's going to get better every day after that.
And you are awake for this, but it's much easier going out than in. And you may experience, there's usually not any pain when you get your catheter out. However, like after the first few times you go to the bathroom, the urine might make it burn just a little bit, so just be prepared for that.
But it'll go away. Sexual function returns as a gradual process. Usually it takes 6 to 12 months to return. It can take longer. Some of the latest research is saying it takes up to 2 years to come back. However, the urinary physical therapist who work with you on getting your urine control back also work with you on your sexual function. They run a penile rehabilitation program, so they'll be working with you with that. Erections are not quite as good as they were prior to surgery. You are also unable to have children after this surgery. You can still have orgasms, but you'll have dry ejaculations.
So Anne, we wanted to ask some questions that come up during the class, a little bit considering going home. Can I go up and down stairs?
Yes. Whether there are stairs up to your bedroom or to your house, it's perfectly fine to go up and down stairs.
Okay. Can I ride my bike?
I don't think so.
Okay.
It's not a good activity after this surgery.
So you wouldn't want to start riding a bike?
I don't think so. No.
Okay. When can I get back to my normal physical activity?
There is no strenuous activity for 6 weeks. Now you can do normal activities such as walking in the immediate post-operative period after surgery, but you should wait on strenuous activity for 6 weeks.
How long will I need the dressing for where the drain was?
It can 3 to 4 days, and it'll seal off. And,
can I wear it after that point if I want to?
You can.
Okay. Is there going to be a stitch where the drain was?
No, we actually cut that stitch when we're removing that drain, so it just closes on its own.
Okay. And when can I take a shower?
You can take a shower the day after you go home from surgery.
All right, thank you very much. We'd like to thank you for joining us today. And again, if you have any questions or anything, you can contact us at 336-832-0314. Just remember that we're not there every day, so it might be a couple days before we return the call. Or you can reach us at prostateclass@conehealth.com.